Let us now continue with our discussion on another set of disorders that would now take effect or take place when there is problem with our pituitary gland or in our hypothalamus. This set of disorders would now refer to the diabetes insipidus, and we have here SIADH, or your syndrome of inappropriate antidiuretic hormone. So what is the hormone affected by this one? In the hormone will now refer to your antidiuretic hormone, or this is also known as your arginine vasopressin. Your arginine vasopressin, or your AVP, or your ADH is responsible in controlling the amount of fluid or amount of water in our body. How does it do that? It does it by controlling the kidneys or regulating the kidneys' ability to reabsorb fluid or water in the body. So in this case, if there is high ADH or pag mataas ang release ng ating ADH sa katawan, what will happen? It will also increase the reabsorptive capacity of kidneys. What do we mean by reabsorptive capacity of kidneys? This means that your kidneys will most likely reabsorb more water in the tubules of its nephrons para ibalik yung fluid na yon dun sa blood circulation. So does it mean that you're going to retain more fluid? Yes. What about decreased ADH levels? In decreased ADH levels naman, pag there is or if there is hyposecretion of ADH or your AVP, what will now happen? This will in turn decrease the reabsorptive capacity of the kidneys. And by that, we mean that your kidneys will not reabsorb fluid in its tubules. So, walang pupunta or hindi masyadong maglalagay or hindi masyadong mag-a-absorb ng fluid ang kidneys natin dun sa tubules para dadami sana yung fluid dun sa katawan. So, in this case, ang gagawin niya, i-excrete niya lang. So, that is for decreased reabsorptive capacity. So, it does not reabsorb fluid in the body. Kasi normally, di ba yung kidneys natin, siya yung mag-absorb ng fluid, siya rin yung mag-excrete ng excess fluid. Siya rin yung mag-excrete ng excess na byproducts ng katawan natin, especially in the blood. So, that is the function of our kidneys in this case. We also have to know that in ADH, okay, wait for a while. Let's just clean this one. Okay, we also have to know that in ADH, it is naturally ADH is naturally produced by the hypothalamus. The hypothalamus is the one that will now produce ADH. In order for it to be released into the blood circulation, what does it do? It will now release ADH into the posterior pituitary gland. And then the posterior pituitary gland will now be the one responsible in releasing this ADH into the blood circulation. So yan, hypothalamus ang magproproduce ng ADH or AVP. This will now transport this ADH into your posterior pituitary gland. And yung responsible na magre-release ng ADH into the blood circulation is the posterior pituitary gland. So kung meron tayong problema sa hypothalamus and posterior pituitary gland, this can lead to either what we call DI or SIADH. So dalawa lang ang pwedeng mangyari sa ating problem with your ADH naman. That is either hypersecretion or hyposecretion of ADH. And these conditions are known as, so we have here SIADH if there is hypersecretion of ADH. or your syndrome of inappropriate antidiuretic hormone. Syndrome of inappropriate antidiuretic hormone. Ang mnemonic ko dyan is SIAD. So, SIADH. We have here, stuck ang ihi dahil sa ADH. So, na-stuck ang ihi mo or yung tubig sa katawan dahil sobrang dami ng ADH natin. So, that is how I remember my SIAD and your DI. So, huwag niyong gamitin ito as your answer ha. This is only a mnemonic for you to remember what is the effect of SIAD or ano yung description ng SIAD. So, again, na-stuck ang ihi or yung water sa katawan natin because there is too much ADH. Yan. Mas maganda ring SIAD yung pronunciation para at least you can remember it more. What about a decrease in ADH levels? This is known as your DI or your diabetes insipidus. For you to remember DI or diabetes insipidus at kung ano yung effect niya or yung description, pinaka-description ng sakit na to, DI would simply stand for ang mnemonic natin, daming ihi. So, daming ihi, DI. Dun sa SIAD naman, stuck ang ihi dun sa loob ng katawan dahil mataas ang ADH. So, ibig sabihin, hindi ka umiihi masyado. So, those are the two disorders arising from hyper and hyposecretion of ADH. So, we have here an infographic illustration of the summary of DI and SIAD. So, in your SIAD, that is soaked inside kasi sobrang daming tubig dun sa katawan due to excessive amounts of ADH. For DI naman, because of the decreased or low secretion of ADH, the patient will now have excessive urination, also known as your polyuria. Kasi nga, walang magre-retain dun sa tubig ng katawan because we lack ADH. So that is the two kinds of disorders we will be discussing today. So in your hand,